or someone you know is at high risk for developing or has developed a blood clot. Blood clots can form anywhere, but most commonly form in the legs, lungs, or brain. If left untreated, blood clots can cause serious medical conditions such as DVT, PE, or stroke, which may result in disability or death. Blood clots are treated and prevented by using medicines called anticoagulants. Warfarin is an anticoagulant medicine sometimes called a blood thinner. Warfarin can lower your chance for developing certain types of blood clots. Warfarin works by slowing down the clotting process. Certain conditions may also increase your risk for blood clots, such as atrial fibrillation, heart valve replacement. Warfarin comes as a tablet and is color-coded according to strength. Your dose of warfarin will be individualized for you and may be a single tablet or more than one tablet of the same strength. The tablet shape may change based on the manufacturer. However, the color should remain the same. Also, check the color of your warfarin tablets before you take them and alert your healthcare team if you notice a change in the color of your tablets. Warfarin should be taken at the same time every day, exactly as directed by your healthcare team. If you miss a dose of warfarin, do not double up on your dose or take extra. Simply plan to take your next dose as scheduled. If you take an extra dose of warfarin by mistake, call your healthcare team for instructions, as this may increase your risk for bleeding. Your healthcare team monitors your warfarin using a blood test called an INR, which tells them how fast or slow your blood clots. It is important to have your blood tested to help your healthcare team find a warfarin dose that's appropriate for you. The INR for someone not on warfarin is about 1.0. The higher the INR, the longer it takes your blood to clot. Your INR goal range is based on your medical history and will be determined by your healthcare team. The most common INR goal range is 2.0 to 3.0, but some people may require a different range. In the beginning of warfarin treatment, it may take a few weeks for your healthcare team to find the appropriate dose for you. This means that when you first start taking warfarin, your INR blood test will need to be checked 1 to 2 times per week. Once a warfarin dose is found that keeps your INR within your goal range, the plan will be to have your INR checked less often, like once every 4 to 6 weeks. Taking your warfarin exactly as directed every day will help keep your INR in range. Although if your INR goes out of your goal range, you may need to get your INR checked more often. Your INR can be affected by the medicines you are taking, as well as your diet and your overall health. It is very important to let your healthcare team know about any changes in the medicines that you are taking. This will include medicines prescribed both at VA and outside of VA, as well as herbal supplements, vitamins, over-the-counter products, medical marijuana, and even medicines you only take for a few days, such as antibiotics. Talk to your healthcare team before starting any new medicine. Your diet also plays an important role in keeping your INR in range and your warfarin therapy on track. Vitamin K is a vitamin found in many foods and can lower your INR. Green leafy vegetables have a lot of vitamin K. The more green leafy vegetables you eat, the lower your INR may become. Green leafy vegetables with high amounts of vitamin K include spinach, kale, collard greens, and cabbage. Animal liver and nutritional supplements or meal replacement drinks are also high in vitamin K. Talk to your healthcare team about your food choices. The key thing to remember is to do your best to keep your diet the same from week to week. If you enjoy green leafy vegetables and eat them often in a week, you may continue to do so if you eat the same amount each week. Just keep in mind your warfarin dose may be impacted by the diet you choose. Alcohol and smoking also affect your warfarin. Too much alcohol may raise your INR and increase your risk for bleeding. You should limit your alcohol use while on warfarin and, if possible, avoid it altogether. Additionally, changes in smoking habits may affect your INR. Discuss any planned changes to your alcohol use or smoking habits with your healthcare team. Be aware that changes in your general health, including infections, fever, nausea, vomiting, and diarrhea, may affect your INR as well. Your healthcare team may want to check your INR blood test more closely when your health changes. It is important to let your healthcare team know about any hospitalizations or emergency room visits that occur in between your appointments. All anticoagulants, including warfarin, increase your chance of bleeding. Seek care if you have blood in your urine, bright red blood in your stool, or stool that looks like black tar. If you vomit red blood, or have vomit that looks like coffee grounds, or if you have bleeding that you cannot stop. In addition, seek urgent care if you have a fall or hit your head. Signs and symptoms of a stroke are facial drooping, arm weakness, speech difficulties. If so, call 911 for help. Signs and symptoms of a DVT are pain, swelling, redness. Signs and symptoms of a PE are chest pain, coughing up blood, shortness of breath. Since patients may be taking warfarin for different reasons, it is important to ask your healthcare team what signs or symptoms of a blood clot you should be watching out for and what to do if they occur. A few last reminders. It is important to take your warfarin as directed. If you are scheduled for a procedure and told to stop taking any doses of your warfarin, please tell your healthcare team. You should not stop taking your warfarin without first talking to your healthcare team. Tell anyone giving you medical or dental care that you are taking warfarin. Tell your healthcare team before traveling for more than a few days, as you may need to have your INR test before you leave. Your healthcare team may be able to arrange for you to have an INR test while on your trip if needed. Remember, your healthcare team is available to answer all your questions regarding your warfarin therapy. Be sure to keep them updated on any changes as covered in this video so that you and your healthcare team can work together to best manage your warfarin. Thanks for listening, and thank you for your service to our country.